Okay. Well, I originally started studying Ayurveda through Maharishi Mahesh Yogi, which I'm sure many of you know.
Yeah.
And I went through the doctor's training course that was being offered back in the mid to late 80s. And what I learned was basic, they taught us basic dosha Ayurveda, the three doshas and the whole three dosha theory and the theory of Nama and all of those general topics. And then I began to practice, and I was very dedicated to practicing Ayurveda. Because I was a TM teacher and a governor and all of that, I was very dedicated to Vedic knowledge. And I attempted to practice, but I found clinically that what I had learned fell short of what my expectations were, and certainly what my patients' expectations were. I certainly helped a lot of people, but only to a certain level. It was mostly basic information about routine and diet and those types of things. And where I got into treating specific conditions or real pathologies, very sick people, I found it difficult to really help them a lot. And so I had done this for a number of years, probably 15, 16, 17 years, when I met Vaidya Mishra. And at that point, I was about ready to just throw in the towel on the whole thing, because I wasn't getting any updates, and there were no people there to give me any new knowledge. One thing that I did learn, and that I had learned right from the beginning, was pulse diagnosis, and my experience in taking the pulse had always progressed through all of those years, but my knowledge about what that experience was had not progressed. So that was really the most frustrating thing. There were things that I could feel in the pulse, but I didn't know what they meant. I could feel changes. I knew that they were significant, but I didn't know how to interpret them, and I certainly didn't know what to do treatment-wise for those things. And I think that was the most frustrating part. Then when I met Vaidya Mishra, I found it to be, I found his approach with patients, first of all, just his personal approach was, and I'm sure those of you who have sat in with him with patients have seen the same thing as I. His personal approach with patients was completely unique. And he takes each patient individually, and his whole demeanor, his style, his recommendations, everything becomes personalized to that patient. I was very impressed by that aspect. And as I got to know him and sitting in with patients regularly, I realized that there's something very, very different about what he's doing than other Vaidyas that I had met. First of all, he was not, at that point he would talk a lot in terms of doshas because he was in that context working for Matthew. But he was certainly going deeper than just talking about Vata Pitta Kapha. And I often wondered kind of what was going on there. And slowly, as we would spend time together just one-on-one, he began to tell me about other things. And he'd talk about prana and soma and these things. And I would ask him, why don't I hear this from other Vaidyas? And finally, he started slowly revealing that, this was part of his family tradition, and unique to those Vaidyas in India who had maintained their family tradition for thousands of years, but pretty much not common knowledge amongst the Vaidyas who had been recent graduates of the schools. And then, so I began to realize that there was something very unique here, not just him, but also in the knowledge that he was presenting was very unique. And so, as I began to use Ayurveda, shudh Ayurveda with my patients, it opened up a whole new world for me. It was like being, that first day, those of you who are doctors, that first day when you're in school, the very first day for me when I was in chiropractic school, I realized, oh my goodness, what am I doing? I'm gonna take people's lives in my hands and do something. It's an amazing feeling that very first day. And I felt like that again. I felt so excited about the possibility of really helping people with Ayurveda, especially when I had been so frustrated before. So we began seeing patients. I remember one of the first patients that we saw was a fellow who had terrible respiratory problems. And he came to us after his doctors had told him that he was going to die of this. And his wife was with him, and she was very upset, and he really looked terrible. He was cyanotic. He'd lost a lot of weight. And Vaidya Mishra took his pulse and gave him recommendations, and then said, come back and see Dr. Beech in 30 days. So he came in and see me 30 days later, and there was a remarkable change. His color was better. There was definitely more life there. He had gained a little weight. He had a smile on his face rather than just sitting with his head down. And I said, my goodness, you look wonderful. I said, how do you feel? And he says, I feel really good, except for one thing. And he stands up and he opens up his shirt and he has this huge rash on his stomach, almost like a burn. It was ugly, and I said, oh my goodness, what's that? He says, I don't know. He says, well, this has happened since I started doing Dr. Mishra's recommendation. And I didn't act